HPM concentrator, probably the only HPM concentrator in this class. Coming into IH 743, implementing programs in developing countries, making programs work. All I knew was Microsoft Office. And I might be the only one, but I am glad that I came to this class because interacting with a diverse team with vast experience, I've attained a lot of technological skills with which I can work to deliver ideas to clients as a consultant. And besides the tools used to deliver products to clients, I've acquired or reinforced my project management, quality improvement, human resource management, and team leadership.
Now, I'll introduce you to the Miss Consultants. This is the group that I've been fortunate to work with from the beginning of the semester. And as you can see in the picture on the left, myself kneeling down, and from the left to the right, we have Shari, Sandrine, Kira, Hubert, and Mahi. And the picture on the right is the Miss Consultants working on a project. We're working with Farm Access in Namibia, and more specifically with the Mr. Sister Clinics. Mr. Sister Clinics are mobile clinics that provide healthcare services, primary healthcare services, to individuals in the remote areas of Namibia, which people would otherwise have not been able to receive care. In IH 743, there's different modules that we are tasked with, and one of them being project management module. And with this module, I have identified 3 key points as a project manager that you need to have. And one of them is the A3 charter, the hierarchy chart or diagram, and then the Gantt chart. With the A3 charter, this is where you have your project outline. You identify your goals and objectives and how you're going to achieve these. And so with the hierarchy chart as a project manager, it's very important for you to know your key stakeholders. Who is going to help you move your project along and make it a success? So once you know that, then you can smoothly sail through the project. And then the last piece on project management is the Gantt chart, which identifies who is going to do what task and when should they have it done by. Now, the human resource management module, as you can see in the diagram, people are very important and they're key players in accomplishing projects. Now, the project you're doing or the business you're running is as strong as the people that are doing it. Now, so as a human resource manager, it's very important to know that when you're recruiting employees, you have a competitive salary and bonuses if need be, and you have them covered health-wise. They have travel compensation if they need it, and 401k when they retire, they have something to fall back on, and most importantly, that there is room for climbing up the career ladders. Quality improvement module, which I had an opportunity to co-lead with Hubert, has 3 key points as well. And you see the current process map where you map out the process as is. This is the current situation when you go in as a consultant. And then from that, you identify the gaps that you have within the process or the waste that's in the process. And so you devise means of getting rid of the waste or filling the gaps that you have. And from which comes the future process map, which should be a lot more condensed than the current process map. And then after that, you have the PDSO cycle, which is plan, do, study, and act. You plan your project. You do pilot projects to test out your plan, and then you study, get the results, and analyze those, analyze the data, and make sure that it's reproducible. So do it again and make sure it's reproducible. So it's a continuous process, quality improvement. And then with the mHealth module, importantly, most of us know cell phones to be used to make phone calls, text messages to friends, family, just to check on them and make sure they're fine. But the healthcare industry right now has made very good use of cell phones or tablets or any mobile devices that you can think of. And so doctors right now can, patient caretakers or caregivers are using these gadgets these gadgets to communicate with their patients, in terms of booking appointments, getting feedback from their patients, making sure that, they communicate constantly between the patients and the caregivers, which is very important. And with mobile clinics, for example, the Mr. Sister Clinic that we work with in Namibia, they use this to communicate to their patients and when the trucks would be in town so that the different people can congregate in one area to see the nurses. And then you could use e-health, to manage patient records.
From this moment, life has begun. From this moment,